Okay, welcome everybody to today's preview of the upcoming Social Security and Medicare workshop. This is a 4-day virtual workshop that's running from starting next week, May 8th through the 11th. If you want to learn more about the workshop or go ahead and sign up, you can do so by going to horsesmouth.com/ssvirtual. I just put that into the chat for those of you joining us on Zoom. And if you're watching on the live stream, a link will be in the description beneath the video player itself. So in today's preview, Elaine Floyd, the leader of the workshop, is joining Horse's Mouth editor-in-chief Sean Bailey to talk about some of what she'll be covering during a few of the workshop sessions and why it matters for advisors and their clients. And today that includes session 3, special situations and beyond the calculators, session 4, introduction to savvy Medicare planning, and session 5, Medicare costs. So Sean, I'll hand it over to you.
Thanks, Doug. Welcome, everybody. Hello, Elaine.
Hi, Sean.
How are you?
Good. How are you?
Good. So on our last live stream, we were talking about why advisors need to know about Social Security. And, one of the points we were making is that, the public comes to Social Security with a mindset of this is important to my retirement. And advisors who haven't really been schooled or had their minds open to the importance of Social Security tend to come at it from, managing assets and IRAs and that sort of thing. And so you were kind of talking about how initially there is a sort of mismatch on the mindsets between the advisors and the clients. And we talked more about that. And we, of course, got into discussing, why, in fact, it is so critical for advisors to have, baseline expertise on this topic, including the fact that there are, many boomers out there who are now just shopping around for a financial advisor. They haven't had one, but now they're shopping around for one because, they've been maxing out the 401k, the house is paid for, the kids are gone, maybe they're even married, and they've been doing it themselves, but they know they need an advisor in retirement because it's just way too complicated, right? And so we went through all that. And so today we're going to talk a little bit about even more important reasons why advisors need to know about the nuances of Social Security. And Doug was just mentioning how the topic for one of your sessions is going to be special situations. So what do you mean by special situations?
There are so many rules and strategies associated with Social Security that the public really doesn't know about. And they don't all affect all people. In fact, some of them affect only a few people, but those are the people who are most in need of, advice and help getting through these, kind of navigating all of these rules. And so that's what we talk about. One example might be the earnings test, for example. So you have a client who is under full retirement age. They are still working, they apply for Social Security. Maybe they got laid off. They applied for Social Security because they needed the income, and then they go back to work and they're still under full retirement age. And, then part of their benefit is going to be withheld for the earnings test. And there's all kinds of math associated with it. There are all kinds of strategies that you can use to mitigate the earnings test. That we're going to be talking about in the workshop, so that if a client does come to you, says, I was laid off, claimed my benefit, now I'm going back to work, now what? So then you know how to answer them, and you know what questions to ask them, and then you know how to proceed from there. So that's the earnings test. Another situation is clients are getting much more savvy about how benefits are calculated, and they're realizing that the benefit is associated with their own lifetime earnings. So they're coming along with questions. Here they are, late 50s, early 60s, saying, wait a minute, if I keep working, can I improve my benefit? Or conversely, what if I retire early? Is that going to cut my benefit? So then they want to get into all the math of how the benefit is affected by their earnings. And, financial advisors really need to be able to guide them here and be able to answer these questions and point them in the right direction. So it's things like that.
Right. Like Social Security Kung Fu or something.
Yeah. Well, okay. Yeah.
Work
Another
before retirement, ha. Work after retirement, ha.
Another big question, special situation along the lines of how earnings impact Social Security is you've got to say a husband and wife, business owners, and they've been assigning the salary to the husband, say, all of these years. And now the question is, well, wait, she comes up to retirement and she doesn't qualify for a benefit because she doesn't have any earnings history. And so the question then is, well, should we switch, his salary over to her? And so there's some guidelines along those lines too. So that's another kind of big nuance. Doesn't affect everybody, affects really a small number of people, but it's another one of those, areas of information that advisors need to understand because they're going to encounter clients who need this.
And of course, this program really kicked off in 2008, which was a terrible time for the economy. And some people claimed Social Security early because they had been laid off. And then the economy got better after a few years, and then they went back to work.
Right.
And now we've kind of metabolized all that and moved on.
Right.
Now the big issue for a lot of people is that they kind of want to work in retirement, and not even just for the benefits, but not even for relating to the cash flow. There's the cash flow, there's building your Social Security benefits, there's the social and emotional aspects of holding down a job of some sort, full or part-time, during your retirement years. And then also there's the taxation issues as well, right?
Yeah, totally.
And
all of it blends over and bleeds over into all the other areas of a client's financial situation. And that, again, is why we feel that it's so important for advisors to, clients start with Social Security. When it comes to retirement income planning, they want to see what they're going to get from Social Security before they determine how much of their, quote, own money they have to use to support themselves. And so all of these other issues, Social Security kind of leads into all of these other things. And that's when the advisor can sit down and really help them with the Social Security, not only, helping them understand how much they're going to get and how they can maximize it by claiming it at the right time, but also how to coordinate it with all of the rest of their income sources. Work, of course, being one of them now for a lot of people.
And of course, the situation of coordinating the benefits with couples especially can sound, somewhat straightforward on the surface, but then suddenly, the advisor discovers that, the wife was a teacher and there's this thing called WEP GPO, and what seemed like was going to be an easy thing is now complicated. Is WEP GPO a special situation, or do you consider it just like a special class of information?
It's a special situation for sure. And it's the reason it's so important. It only affects like maybe 3% of all Social Security recipients.
Can you explain, by the way, what we're talking about, the WEP and GPO? I shouldn't have.
Sure. So when a person works in a job that did not pay into Social Security, so there are a number of school systems around the country, some local governments, when they kind of formed their own retirement plan, they went to Social Security and said, hey, we want to opt out of Social Security. We want to have our own retirement plan. We think we can manage it better. We think we can do it better. The federal government used to be under its own plan, but then in the 80s, it switched over to Social Security. But there are still a lot of employers that still, where the employees pay into an alternate retirement system. So without getting into the details, which we do in the workshop, actually, of how the benefit is calculated in those situations, because it is reduced, the important thing to know about it is that the statement that, so let's say you've got a client who was a teacher in California, for example, and they worked most of their career not paying into Social Security, but then they also had other jobs, maybe before or after the teacher job, where they did pay enough into Social Security that they qualify for a Social Security benefit. So they get their statement and they see what the amount is going to be, and they don't realize that that is going to be reduced by as much as $500 a month because of this WEP, the windfall elimination provision. And so it's so important for financial advisors when they're first working with clients. And, one of the first pieces of information they want to see is that Social Security statement. They're going to look at it. They're going to, after learning about all this, they're going to know to ask the client, did you ever work in a job that didn't pay into Social Security? And we give you kind of some tips to, like, if you're looking at a statement, some tips so that you'll kind of that will trigger that question, because it doesn't apply to all people, of course, but there are some clues in the statement that would lead you to say, hey, did you ever work in a job that didn't pay into Social Security? And if they say yes, they of course know that. Then the advisor can then say, well, your Social Security is going to be much lower than this says. And then we, of course, talk about the tools and the formula to go ahead and estimate that benefit, that WEP adjusted benefit.
Right. Yeah. So those are all, good. The special situations, really important stuff for the advisor to know about, especially when the special situation doesn't lead to greater benefits, leads to smaller benefits.
Exactly.
And well, that may be a good time for us now to transition over to the other topic that you'll be covering, which is Medicare, which is both a great thing. People feel relieved by Medicare. They feel happy with their Medicare, but there's all sorts of, well, I shouldn't say many, but there are some hidden penalties and things in there. So let's talk a little bit about how deeply is the program going to get into Medicare? Why do advisors really need to know about Medicare so much?
Okay. So a few things. Yes, people are very happy with their Medicare. Usually that happens after they go on to Medicare. People, before they go on to Medicare, we have found that they tend to be a little bit resistant, and they see Medicare as this government program and the government usually doesn't, well, people have ideas about how the government manages things. Anyway, they tend to be a little bit resistant about going on to Medicare. They don't know about Medicare. They just don't know. They don't understand it. And so it's really important for advisors to be able to accurately describe, what Medicare is and all of the enrollment rules. That's kind of the first part is, when you can and when you should and when you actually must enroll in Medicare, because people don't realize that Medicare is the health insurance system for people over 65 today. We're all used to dealing with private insurance when we are working. Our employers provide insurance through private insurance companies. And then people hit 65 and they don't realize that now there's a whole different system that they qualify for. And even the private insurance companies, their products are built around Medicare. And so it's sort of this public-private partnership that's a little bit complicated, but again, it's something that clients are often seeing this for the first time when they go to retire. And when they turn or when they turn 65, nobody has ever really talked to them about Medicare. The employer plan is completely separate, and the people who, the agents who sell that employer plan and the HR people who manage that plan, all they know is that plan. And then the client goes to retire, and they're told about COBRA, they can stay on the plan at their own expense if they want. But those people who are working with that employer plan, they don't get Medicare. They don't understand it. They're not incentivized to understand it or talk to clients about it. And so clients are just kind of bereft. And it's really falling to the financial advisor to step in at that moment and inform clients as to what their Medicare status is at that time.
Right. And of course, we've seen over the years stories about clients taking, Social Security claiming advice from, the guys down at the tavern.
Yeah.
Or as it relates to Medicare, sometimes taking advice from, the good people in HR who have kind of always responded to their questions about their health plan. But we've discovered over the years that swinging from the health plan run by your company to Medicare and taking advice from people in the HR department sometimes not so good because
Right.
they think they know, but they don't. And,
Right.
what
Yeah.
happens in place? Can you give us some examples of like what that's all about?
Well, the COBRA is the biggest example. That's what HR knows. They're required by law, if they have more than 20 employees, they're required by law to offer COBRA. And it's a terrible option for people who are 65 or older. I won't get into we do get into the details in the
In
workshop,
class,
but
yeah.
it's the worst option ever for them to go on to COBRA. Yeah, there was something else.
Well, it's about this whole thing about how difficult it is to make the transition.
Yeah.
Is something you've been saying for years.
Yes.
It's a big, rude awakening.
It's a rude awakening. And the other thing is, we go into depth on the things that advisors need to know about, but we don't go into depth on the things that they don't need to know about.
Right.
And that's the tricky thing about Medicare. Medicare deals with healthcare, for heaven's sakes. It deals with a person's, medical health status. And, it's not necessary for advisors to look into clients' medicine cabinets, to know their health history. That part is not, that's for other people to deal with, their doctors and their, other providers and and even their insurance companies, because they will have private insurance to go with their Medicare. The thing that advisors need to be concerned with is the money part of the whole thing. And so avoiding those late enrollment penalties, making sure they sign up for Medicare on time. If they go to get private insurance, which they should, shopping for the right policy, and they can get
when
help
you say
with
that, when you say private insurance, are you referring to the supplements or
yes,
also
the supplements,
Medigap?
yes.
Mhm.
Yeah, the Medigap, the supplements, the drug plans, things like that.
Right.
So shopping for those so they're not overpaying for them. People get into trouble, they go on to Medicare and they're still contributing to a health savings account at work. Can't do that. That's against the rules. They'll get hit with an over contribution penalty. So
Right.
advisors need to definitely be concerned about that. They need to be concerned with the IRMA, the income related monthly adjustment amount.
Right.
And this is very, very common for high income clients, who they go on to Medicare, they're still working, they have to pay that IRMA, and then that leads into the whole area of tax planning.
Right.
Advisors are used to doing tax planning, and that is great. They've saved over the years, millions and millions of dollars, but now they have to incorporate the IRMA into that tax planning, and it just adds like a new wrinkle to the overall tax planning. So those are the key things. We limit our instruction, shall we say, to the issues that advisors really need to be concerned about. And then we draw the line, though, when it comes to like all the health stuff.
Digging too deeply. Yeah. Right.
Yep.
Right. Yeah. It's not a program that is educating you to go out and start selling Medicare. It's not at that level. Not at that level.
Right.
But it is one that gives you fully rounded understanding of Social Security and Medicare and the interplay of both those into your retirement income plan and taxes, as well as the IRMA is a good example. And advisors really need to know about IRMA because other clients, even the most well-heeled ones, can be kind of pissy when they discover how much they
they're going to be paying. That's
spending, for themselves and often the spouse too. So
and there are strategies. There are definitely things that clients can do to mitigate the IRMA. Regular tax planning, but also specific things related to the IRMA, like appealing it when you retire and things like that. Right. So we go into great detail on that in the workshop.
Yeah. All right. Okay. Well, this is one of our live streams. Our live streams run 20 to 30 minutes. They're not a full-blown webinar. It's just kind of a way to inform advisors out there on the different social media platforms what we're doing. And so that kind of does it for today. Elaine, thank you so much. We hope to see everybody next week at your workshop, which starts on Monday, ends on Thursday, goes from noon Eastern time to 3 p.m. Eastern time. You can adjust for your time zone. And we'll be back again with a live stream soon too. So thanks and take care, everybody. Have a good day.